Bringing a new life into the world is a joyous occasion, filled with love and anticipation. As future nurses, it's important to understand how to support newborns from their very first moments, ensuring their health, safety, and a strong start to life. One area that often raises questions is neonatal hypoglycemia, a condition characterized by low blood sugar in newborns. Understanding neonatal hypoglycemia empowers nursing students to educate and support parents, helping them confidently advocate for their newborn's health. This guide provides clear, evidence-based information about neonatal hypoglycemia, equipping nursing students to educate families and support informed decision-making. We'll explore normal blood sugar levels for newborns and why maintaining these levels is crucial for their health. Recognizing the signs and symptoms of neonatal hypoglycemia is paramount, and we'll delve into the cues that might indicate an issue. Neonatal hypoglycemia occurs when a newborn's blood glucose levels fall below the normal thresholds, typically under 40 mg per deciliter in the first 4 hours after birth, and under 45 mg per deciliter thereafter. This condition can be transient, resolving on its own, or it can be persistent, requiring more intensive management. Understanding these thresholds and variations is critical, and it aligns with the AACN essentials that emphasize evidence-based practice and informed clinical decision-making. Glucose is the primary source of energy for our bodies, especially for rapidly developing newborns. In the first few days after birth, maintaining stable blood sugar levels is crucial for a newborn's health. For newborns, a blood sugar level below 45 mg per deciliter is generally considered low. These levels can fluctuate as the baby transitions from receiving glucose through the placenta to relying on their own stores and feeding. While a slight dip in blood sugar is normal, prolonged low levels can be detrimental, particularly for the developing brain. The brain requires a constant supply of glucose to function optimally. When blood sugar levels drop too low, the brain doesn't receive the energy it needs, potentially leading to problems. By working closely with healthcare providers, parents can help ensure their babies receive the care they need to thrive. While any newborn can experience low blood sugar, certain factors increase the likelihood of developing neonatal hypoglycemia. Understanding these risk factors can help parents be more vigilant in monitoring their babies. One common risk factor is prematurity. Babies born before 37 weeks often have lower glucose stores and immature regulatory systems. Similarly, babies born small for gestational age may have limited glucose reserves. Maternal diabetes during pregnancy can also increase the risk of neonatal hypoglycemia. High blood sugar levels in the mother can lead to high insulin levels in the baby, causing their blood sugar to drop after birth. Recognizing the signs of neonatal hypoglycemia is crucial for prompt intervention. Some babies may exhibit clear symptoms while others might present with subtle cues. One common sign is jitteriness or trembling. This might manifest as shaking of the baby's arms, legs, or chin. Lethargy or floppiness can also signal hypoglycemia. A baby with low blood sugar might seem unusually sleepy or lack energy. Feeding difficulties are another potential indicator. Babies with hypoglycemia might have a weak suck or tire easily during feeding. In severe cases, symptoms can include bluish discoloration of the skin, apnea, or seizures. Diagnosing neonatal hypoglycemia involves measuring the baby's blood sugar level. This is typically done through a simple blood test, usually a heel prick. The timing of these tests is crucial, as blood sugar levels can fluctuate after birth. For low-risk babies, blood sugar levels are usually checked shortly after birth and before their first feeding. If initial tests show normal levels and the baby exhibits no signs of hypoglycemia, further testing might not be necessary. For high-risk babies, more frequent monitoring is recommended. Continuous glucose monitoring, or CGM, involves placing a small sensor under the baby's skin to measure blood sugar levels. This provides real-time data and alerts healthcare providers to any significant fluctuations. Treating neonatal hypoglycemia typically involves raising the baby's blood sugar level. The specific approach depends on the severity of the hypoglycemia and the baby's overall condition. For mild cases, frequent feedings might be sufficient to stabilize blood sugar levels. Breast milk and formula provide readily available glucose. Skin-to-skin contact with the mother can help regulate the baby's temperature and encourage breastfeeding. If frequent feedings are not enough, intravenous glucose might be necessary. This involves administering a glucose solution directly into the baby's bloodstream. In some cases, medications like glucagon might be used to help stabilize blood sugar levels.